Okay, chapter 21, poisoning and overdose emergencies. You guys will run into quite a few calls regarding this. Typically, it's going to be somebody purposely overdosing or poisoning themselves in an attempt to commit suicide. The accidental poisoning and overdoses really just doesn't happen all that often. It does, but typically it's done on purpose. So we're going to cover poisoning, alcohol, and substance abuse. Alright, so a poison is any substance that can harm the body, regardless of how it's absorbed into the body, whether it's ingested or gone through the skin or other membranes. It's going to harm the body, and that's considered a poison. And this harm can result in a medical emergency, depending on what the poison is or how much the patient has been exposed to. So some common poisonings, medications. Now you wouldn't think of that as a poisoning, but medications, there's a safe limit that people can take. Beyond that, an overdose situation becomes a poison to the body. Petroleum products, oil and things like that, anything with petroleum in it. Cosmetics can also be a poisoning. Pesticides, that's a big one. Plants, these are different plants out there that you should not ingest, or it can cause a reaction when you come in contact to it. Food, we kind of covered that with the allergic reactions. It can be a poison depending. The effects of a poison. Harms to body based on the nature of the poison, its concentration, route of entry, age, weight, and the health of the patient. All that determines on how much the poison affects the body. Can damage the skin and the tissues just from the contact, especially your acids and your caustics. Can cause suffocation, can affect the respiratory system very easily, or it can be localized or systematic damage to the body systems. So poisoning is classified by the route. Ingested means that they swallowed it. There's a lot of different poisons people will try to do, typically medications. I've had people that will swallow bleach in an attempt to commit suicide. That's a shitty way to go. Inhaled, they breathe it in. You ever hear of people huffing or doing whippets, etc.? That's actually a poison that they're inhaling. Absorbed through the unbroken skin, or injected, which is inserted through the skin. So EMT's own home and squad buildings should be child-proofed against poisoning. All your cleaning products and things like that should always be stored away from children. My God, they can get into everything. There's a very cheap and inexpensive means to child-proof your home. Share poisoning prevention info with members of the public when you're doing visits or community outreach programs. Here's a little diagram showing the routes of entry there. Alright, so a child can accidentally eat or drink a toxic substance. Just because they do doesn't mean it's bad parenting or anything like that. You should always try to prevent them from getting into things like that, but kids will be kids. In an instance where a child is poisoned, you want to keep a high suspicion that it wasn't the child itself. Unfortunately, there's a lot of parents out there that should not be parents. They're just complete assholes and pieces of shit, in my opinion. But they will purposely harm their children by a lot of different means, including poison. If you run into calls like these, I can't tell you that to keep calm and all that. It's extremely difficult to do so. In the cases of child abuse, if you like your job, you like your license, try to keep a level head, go about things the right way. Can't say that is always the case with EMTs and paramedics. An adult, often an accidental or deliberate medication overdose. Sometimes with the elderly, especially when they have Alzheimer's, dementia, when that starts to set in, they may accidentally overdose on their medications. They may forget that they took their morning meds already and take it again. But typically, the accidental overdoses really don't have to worry about too terribly much. The only times that you do is medications that have a very small window of uh, what the medication should be taken, such as hypertension meds. If they may take double the dose on that, they may tank their blood pressure. But typically, you can intervene and reverse the effects. Deliberate medication overdose, they will typically take quite a bit. Some people will do their research and know exactly the right amount of medication to take, as well as what medication to take, to where you can't reverse it. They will commit suicide one way or the other. It can be a very slow and painful death. I've seen it in patients. I showed up for one guy. He had texted his friend to, take care of his wife and his 2 kids. We show up. He was very, very cooperative. Wouldn't tell us exactly what he took. But he's like, we could go to the hospital if you want. He's like, you're not going to save me. He had done his research. He had taken hypertension medications as well as some others, and he took the right dose possible. It took him a week to die. They did everything that they could in the hospital, but he did his research. Some medications, such as Xanax, people like to try to overdose on Xanax quite a bit, or Benadryl. It's a very common one. Very tough to overdose on those. Typically, they're just going to sleep, and you just provide palliative care till you can get to the hospital. So with your assessment, you want to know what was involved. Look for the container, check for labels, and transport those medications or whatever they may have taken with the patient to the hospital. Now with the medication containers, also look for other people in the home. And a lot of times they won't take their own medications, they'll take somebody else's. If they've had prior suicide attempts, a lot of places will only give them so much medication per week to prevent overdosing. When did the exposure occur? When did they take it? All right. You need to know how long ago it was, how much they took. Quick-acting poison requires faster treatment. ER personnel need to know for appropriate testing and treatment. How was it ingested? A lot of times you can estimate the missing pills by looking at this prescription label. When was it filled? How many was in there? How many are there now? Etc. Over how long a time did the ingestion occur? Typically, if they're trying to purposely harm themselves, it's all at once. But, definitely ask that question and determine if it's been over a long period of time. You can actually poison yourself with Tylenol, ibuprofen, etc. by taking too much. It builds up in your system and is beyond the normal limits. So treatments may vary. Was the medication taken for the very first time? Was medication being taken chronically? What interventions have been taken so far? Treatments indicated on the label. If it's an accidental overdose and they realize it, they may try that. If they're doing it on purpose, they're not going to look. Any home remedies, syrup or Ipecac, which will make you puke an awful lot. Depending on the poison, you don't want people throwing up. You need to control the nausea and the vomiting. What is patient's estimated weight? That, again, as we covered, the patient's age, weight, their health, affects how much the poison will affect them. The rate of onset of toxic effects is related to the weight. The bigger people, they can take a lot more before it affects them. What effects has the patient experienced so far? And it depends on if they're cooperative, if they'll even tell you all of that. Nausea, vomiting, altered mental status, abdominal pain, diarrhea, chemical burns around mouth, and unusual breath odors. These are not all the effects that patients can have. That's just your main ones. So food poisoning can be caused by improperly handled or prepared food. Always cook your food. Make sure it's completely done, except for steaks. If you're one of those that eat your steaks well done, I'm totally judging you right now. Symptoms: nausea, vomiting, abdominal cramps, diarrhea, fever. May occur within hours of ingestion or a day or two later. If you've ever had food poisoning, it is god-awful. It definitely takes a lot out of you. So activated charcoal works through adsorption. That's a D, not a B there. That's not a misprint. Allowing substances to attach to its surface. Okay, it's not an antidote. It's not a cure-all. It does prevent or reduce the amount of poison absorbed by the body. Many poisons, but not all, are absorbed by activated charcoal. It's just not something that's really carried on the ambulances anymore, at least not in this area. But it's definitely something you should know in case you do get onto a service that still carries it. Medical direction will determine whether the use of this substance is appropriate or not. For the services that may carry it, typically you're going to have to call and get an order to give it to the patient. Now, activated charcoal versus the syrup of Epicac. God-awful stuff. The syrup was preferred treatment for poisoning. Induces vomiting very quickly, projectile vomiting in most people with one dose. However, it has the potential to make a patient aspirate, which is where the liquids or the emesis gets down into their lungs, and only removes less than 1/3 of the stomach contents. Dilution. Adult patients should drink 1 to 2 glasses of water or milk. Children should drink 1/2 to 1 full glass of water or milk. This is to dilute the poison in their stomach. Water may slow absorption, but milk may soothe a stomach that is upset. Frequently advised for patients who, as determined by medical direction, do not need transport. Antidotes, thought of as a substance that will neutralize the poison or its effects. There's very few genuine antidotes that exist. You're not going to really be carrying anything on your ambulance other than Narcan. So Narcan reverses narcotics' depressant effects on level of consciousness and respiratory drive. Okay, it just kind of blocks the receptors to bring them around and allow them to breathe on their own. It doesn't take away the actual effect of the heroin or whatever narcotic they took. It's still in their system, and when the Narcan wears off with its half-life, it's going to go back to the overdose. Just a bunch of pictures here. There we go. All right. So think about your own home. Is it safe for a small child? Do you have things child-proofed, locks on the cabinets where you store your cleaning supplies, etc.? Are there potential poisons within 3 feet of the floor or behind unlocked doors? Are there household cleaners that look like juices and drinks familiar to children? This used to be more of an issue in the past because of labeling and other designs now. They've gone away from that to where it's not as confusing to a child. Can flavored children's medications be mistaken for candy? Yeah, absolutely. The pharmaceutical companies, they try to make children's medications taste like, cherry, grape, etc., so that the children will take it. As an adult, don't have to do that. You're swallowing pills or you need it, so you take it regardless. But with children, they try to make it taste better. I've had my kids where they absolutely love taking their medication because they like the taste of it. Now, there's child-proof caps and everything else, but if they were to get into it, because they enjoy the taste of it, it's possible for them to overdose. What sense does a small child typically use to identify things? Remember, everything goes into their mouth. Taste. That's how they learn. So inhaled poisons, common types, carbon monoxide. These are the people that will lock themselves in the garage or run a hose from their exhaust of the car into the car and try to commit suicide that way. Can also be accidental. Ammonia, chlorine gas, agricultural chemicals and pesticides, and carbon dioxide. Anytime you have cleaning chemicals, bleach, and I forget what the other one is, you don't want to mix them. It does happen. You'll show up people respiratory distress, sore throat, maybe a little bit altered, and then it just turns out that they were cleaning and they mixed too many cleaning products together. So scene safety. Approach a scene with caution anytime that it may be a possible overdose. Protective clothing and self-contained breathing apparatus may be required. Unfortunately, on an ambulance, we don't have a 4-gas monitor. We can't determine what's all going on, what we may be walking into. That's something that fire can do. And if you believe that may be an issue, definitely get fire en route and protect yourself. Not trained or equipped, call for additional resources for the fire department. You can see there, working on his car there, probably had it running. Had to call the fire department to go in with their SCBAs to get the patient. So inhaled poison, signs and symptoms, difficulty breathing, chest pain a lot of the times, coughing, can be productive or non-productive, hoarseness, when they're talking, you'll hear that. They'll be extremely dizzy quite often. They'll have a headache, be confused, altered mental. Late stage is seizures. Depending on how long they've been in there, they can be unconscious. There can be vomiting a lot of the times. I had one patient tried to commit suicide. He laid down in his garage and fired up his lawnmower and his car. The oxygen became so depleted in the garage from the vehicles running that the vehicles actually shut off. There wasn't enough oxygen to pull in and actually burn the fuel. So he had to get up and start them again. When I arrived on scene, garage was still closed up. We opened up the garage door, went in. He was unconscious. He had puked. I'm sure he probably aspirated. Very close to death. We ended up saving him, and when he came to, he was pissed. He was pissed. He wanted to die, and those are the people that, regardless if you save them or not, they will find another way. Alright, so the assessment, what substance was involved, the exact name, if you know it, when did it occur, how long were they exposed to it, what interventions has anyone taken so far, did they remove the patient from the area, did they ventilate, and what effects is the patient experiencing. Move patient from unsafe environment using trained and equipped personnel, detect and treat immediate life-threatening problems in primary assessment, do your secondary assessment, and obtain vital signs. High flow O2, especially with difficulty breathing, transport with all containers, bottles, and labels. This one I don't fully agree with. We have cell phones now. You can take pictures, of what may have happened. If there is any chance that you may be exposed to it, don't take it with. You don't want that in the ambulance. Just leave it there and take a picture. It's different with medications. That's not going to affect you. You can take that with. Perform reassessment and route. Carbon monoxide. Colorless, odorless, tasteless gas created by combustion. Can be caused by improper venting of fireplaces, portable heaters, generators. Common cause of death during the winter and power outages. Always be aware of that. People will try to heat their homes any way possible when out of power. It's pretty common, actually. So headache, especially a band around the head, um, that's kind of talking about where the pain's at. Be extremely dizzy, difficulty breathing, nauseous, vomiting, cyanotic. They're not getting enough O2, so they'll have that bluish tint. They can be altered. In severe cases, unconsciousness. And then also be aware, um, you may have multiple patients in instances like this. There's actually a mass casualty not that long ago in Knox County where people were having a fish fry in this large outbuilding, plenty of area for everybody, but they were doing the cooking inside, frying the fish and everything else, and they had grills in there, cooking other types of food. Nobody thought about it. There was ended up being about 30 patients that were poisoned by carbon monoxide. Took a lot of resources. Everybody had to go out to Iowa City for hyperbaric chambers. Just need to be aware of that. CO monitor, great thing to have. It's just not something ambulances really carry. But fire departments do have them. If you have any suspicion of it, definitely call the fire department. Also something, they're fairly inexpensive. It's something you may want your service to look at getting, especially if you're a volunteer service. It's career services where they have multiple ambulances is probably not something that they're going to do. So treatment with carbon monoxide. Patient may begin to feel shortly after being removed from the dangerous environment. Administer 100% O2 and transport to the hospital. It takes time to wash out the CO from the bloodstream. That's in there, it's being poisoned. They definitely need a high flow O2. May be beneficial to put them on capnography if you have it by nasal cannula, just to monitor their breathing. Smoke inhalation. Smoke from burning materials can contain poisonous and toxic substances, including CO, ammonia, chlorine, cyanide. There's a lot of nasty shit in the materials that we burn nowadays, the plastics. All your furniture in your houses has petroleum base. It's nasty stuff. Especially for you firefighters, always make sure you're wearing your SCBA. Even during overhaul, you need to be wearing your SCBA. You need to monitor the air. Only take that off when it's safe to do so. A lot of cancers that firefighters are exposed to because of that. Substances can irritate skin and eyes, damage lungs, and progress to respiratory or cardiac arrest. Signs and symptoms: difficulty breathing, coughing, smoky or a chemical smell on breath, black residue in the mouth, nose, or sputum. When you breathe that shit in, it gets down in there. Singed nasal or facial hair. So the treatment: move them to a safe area, assess the patient, your ABCs, maintain that airway, high flow oxygen, monitor patient closely. Airway burns may lead to swelling of the airway. This is superheated gases from smoke or flames themselves. Need to protect that airway. Great idea to have ALS en route and put the patient down and intubate them before you lose the airway entirely. Detergent suicides. Method of suicide started in Japan, becoming more common in the US. I've never heard of any instances in this area. But mix of two easily obtained chemicals to release toxic hydrogen sulfide gas. Commonly released inside enclosed spaces such as a car. Typically, these people will leave a note on the window not to just open it. They're nice enough they want to commit suicide, but they don't want to harm anybody else. Scene safety, always the utmost important. Exposure to fumes can injure you and your personnel. A warning note left on vehicle, but this is not always the case. May need to treat first as a hazmat scene. Definitely do that. Absorb poisons, absorb through the skin. may or may not cause damage to the skin. They can require decontamination prior to treatment, especially on your hazmat scenes. You're going to have your hot, your warm, and your cold zone. You guys will be in the cold. They will go through decon, be rinsed off, etc., before they are brought to you so that you are not exposed. So the assessment, pretty easy here. You're seeing the same thing over and over again. What was involved? How did the exposure occur? How much were they exposed to? When? How long? What interventions has anyone taken? And the effects. What symptoms? Assess for immediate life-threatening problems, your ABCs. Perform your secondary assessment, vital signs. Remove powder by brushing off the powder, irrigating with clean water for at least 20 minutes, and during transport. Transport with all containers, bottles, MSDSs, and labels from the substance. Again, if it's something that you can be exposed to, if it's not properly contained, leave that shit at the scene. Perform reassessment as always. So injected. Illicit drugs injected with a needle, and this is your heroin and all the other shit they got out there now. That's typically what you're going to run into in this area. A lot of overdoses that way. Venom of snakes and insects. Not so much around here. It does happen. So poison control centers. That's going to be your best resource on what to do. You can call, give them what substance it is, and they will tell you the treatment that is recommended. They have a ton of info on the poison signs and symptoms and treatments. Follow a local protocol for contact procedures. This number should be posted in every ambulance. If it is not posted in your ambulance, please get it posted. It's also a great idea to have it saved in your phone to be able to call. Alcohol and substance abuse. A lot of calls are going to be because of this. A lot of calls. It's going to be anywhere from 8 o'clock in the morning to 3 a.m. I mean, it's 24 hours a day. Be amazed how often people are drinking all day long or using drugs. So many patients whose conditions are caused either directly or indirectly by alcohol or substance abuse. Abuse of alcohol and drugs, it's everywhere. Doesn't matter the economic boundaries or the area that you're in. Although if you're in Kiwani, it seems to be a much larger drug issue than in the Quad Cities. So alcohol abuse. Potent drug affects central nervous system. I'm sure you guys have all been drunk before. You know how it affects you. Imagine doing that every day. It can be very addictive. Emergencies may result from recent consumption or years of abuse. They become too intoxicated, too much alcohol, an acute time. There's a lot of vomiting, may not be able to protect their airway. That nervous system is affected. A lot of different things that can happen. Abuse, from years of abuse, they're typically going to have liver issues, abdominal issues. There's a lot that can happen with that. Treat patients as any others. Abuse can lead to or worsen other medical conditions. Alcohol, often consumed with other drugs, can result in a serious medical emergency. You need to know how much they took, what they were drinking, that plays an effect. If it was hard alcohol or just beer. Impaired patients can be uncooperative or combative. Extremely. Anytime you're dealing with a drunk person, be on high alert. Things can change dramatically. A lot of people get very mean when they're drunk. It's just what it is. Yeah. Worry about your safety and your crew before all else. Contact law enforcement if safety is a concern. A lot of the times with drunk people, law enforcement will already be there. PD will actually call you for drunk people to take to the hospital. So signs and symptoms: alcohol odor on breath or clothing, Swaying or unsteady on feet. They'll have that abnormal gait, stumbling around. Slurred, rambling speech. Flushed, complaining and being warm. Nausea, vomiting, poor coordination, and slow reaction time. They can have blurred vision, can be very confused, altered mental hallucinations, visual or auditory, lack of memory, blackout. Been there a few times, and like I said, altered mental status. You will get called out for alcohol withdrawals. It happens a lot of the times. These people, they've been drinking chronically for years. May just be they're out of money currently, can't afford any alcohol for a few days. They're going through withdrawals. So it's an abruptly quitting of drinking may cause some alcoholics to suffer from delirium tremens, DTs. Can be serious, resulting in tremors, hallucinations, and seizures. You'll see the tremors quite often. They'll be shaking, cold. They're gonna feel like shit, and they're used to feeling, drunk. The effects of alcohol all the time. Without that, their body is craving it. These can be very serious. So confusion, restlessness, unusual behavior, hallucinations, growth tremor of hands. You'll see it in the hands all the way up their arms and their lower extremities as well. Profuse sweating, seizures, hypertension, tachycardia. Assessment, just like any other. Many medical conditions mimic alcohol intoxication. Remember, low blood sugar is one of them. They can also have other medical problems. Don't always just write them off as, it's just somebody that's drunk. You still need to do your full assessment. Vomiting, standard precautions are essential. Gloves at the minimum. If you want the entire get up with the face mask and all that, protect your eyes, by all means do so. Always keep suction ready. With that depressed nervous system, they may not be able to protect their airway. Aspiration is common. You need to be ready to suction it out. Stay alert for airway and respiratory problems throughout the call and changes in mental status. Vital signs: treat for shock, gather history from patient and bystanders or family, stay alert for seizures, transport to a hospital. Any chemical substance taken for other than therapeutic medical reasons, consider substance abuse. Includes uppers, downers, narcotics, hallucinogens, and volatile chemicals. So you can see here you got, well, we won't cover how much of this I've seen and what I know, but yeah, you're going to see a lot of this. Now, remember, marijuana is legal now here in Illinois. We don't really worry about that, but you still need to know if they're using it recreationally, okay? Still affects the body. Upper stimulants that affect the nervous system, gonna increase their heart rate and everything else. So you got cocaine, amphetamines, it can be snorted, smoked, or injected. People will find any way to get it into their system. Be excited, restlessness, increased pulse, breathing rates. They can be diaphoretic, hypothermia, no sleep for a long time, possibly days. You show up for a meth head, they won't have slept for a week, and they're still jumping off the walls all jittery. Downers, it's a depressant, barbiturates, roofies, GHBs, will be sluggish, poor coordination, decreased pulse respirations. One way to tell this with barbiturates from a narcotic, their pupils will be very dilated with barbiturates, where a narcotic is going to be constricted. So narcotics used to relieve pain or help with sleep: opiates, heroin, codeine, morphine, oxycodone. You'll see it all. So reduced rate of pulse and rate and depth of breathing. They'll be very lethargic. Pinpoint pupils, super constricted. profuse sweating, and late-stage coma, and respiratory arrest, cardiac arrest. Hallucinogens create intense state of excitement and distorted perception. You got your LSD, PCP, XTC, you got Molly, all sorts of different shit out there now. You got rapid pulse. Oh, don't forget shrooms too. Rapid pulse, dilated pupils, flushed face, seeing or hearing things. Their view on reality is completely distorted. You got chemicals produce vapors that are inhaled. Initial rush can act as central nervous system depressant. These are your people that are huffing and doing other inhaled drugs. Be dazed, disoriented. Coma is very possible with these people. It's going to affect the nervous system, their brain. They're also going to be typically very hypoxic at first from inhaling all of it. Swollen membranes in the nose or mouth can happen. Funny numb feeling, tingling inside the head. Changes in heart rhythm is very common. People that are huffing always look for signs around their nose or mouth, especially like if they're huffing paint, which I don't know why you would huff that, but you'll see residue, paint residue around their nose and mouth. They can also definitely have bloody noses quite often, so be aware of that. So assessment can be difficult depending on the level of consciousness of the patient. May have taken more than one type of drug. That's very common. They can be uncooperative or combative, especially if PD is already on scene. Be aware of a possibility of contaminated needles in the presence of chemicals. Anytime you're around anybody with drugs, just assume there's a dirty needle somewhere. Patient care. ABCs, right? Be aware of possible airway problems, respiratory distress. Provide O2. And use a BVM if needed. If you need to assist their respirations. Treat for shock. Talk to the patient to keep them calm and cooperative. Keep them awake. Talk to family and bystanders too that may be able to tell you what they've taken. Perform a physical exam. Look for evidence of injection sites, track marks. This is a tough one. Okay. A lot of people are going to shoot up in their arms. Typically, the hardcore junkies, they don't give two shits. If anybody knows, they're going to shoot up in their arms. Easy access, right? People that are trying to hide it will shoot up in their toes. I've got quite a few patients. You'll see the mark, okay? There'll be redness around the site, etc. Regardless of how well they try to do it. They're injecting a poison into their body. They will find all sorts of different ways of people that are trying to hide their addiction on where they inject. So there, looking at the arm, you can see all the injection sites. Those are older. You can see they're kind of scabbed over. The veins are shit. They're destroyed from all that poison. They'll also a lot of times have sores all over their bodies, especially with meth. I'm sure you've all seen pictures of the meth heads. It's unfortunate. People go down this road, but it's something that you're going to have to deal with. Transport as soon as possible. Contact medical control regarding the poison, or follow your local protocols. Perform reassessment with monitoring vital signs just as any call. Reassure the patient throughout all phases of care. Quick review here. Poison patient, perform a primary assessment and immediately treat life-threatening problems. Sure open airway, high flow O2, if the poison was inhaled or injected, or if they have a low pulse ox, titrate to effect. That's with any call, right? You're seeing a pattern here on how you treat patients. It's all the same. Secondary assessment, baseline vitals, find out what was ingested, inhaled, absorbed, whatever, what the substance was, how much, when they took it, and what symptoms they're having. Pretty much like any other call. Consult your medical director per protocol. Administer activated charcoal if needed, water or milk. Remember using the poison control hotline as well. If it was an inhaled poison, remove the patient from the environment. If you can't do so, call fire and they will do it for you. Transport the patient with all containers, bottles, and labels from the substance. If it's a medication, absolutely. If it's something else, you can take a picture of it. Don't expose yourself to it. Reassess. Document all info about poisoning interventions and their response, just like any other call. Safety is always the first concern. Your safety is, not the patient's, yours. You and your crew, they come before the patient in all calls. Poisonings are generally classified by a route of exposure. Always reassess. Poison control centers offer a great amount of information. There's also apps that you can have for your phone. Alcohol is a common issue that you're going to run into. It's a lot of times an underlying issue with patients. Can be a very significant problem depending on how much they have consumed. The effects of substance abuse can vary greatly depending on what they're abusing. Determining the type of drug ingested can shed light on the effect to come. Alright, some questions to consider. What are potential risks to the responder on a poisoning or overdose call? You may be exposed as well to the poisoning. You can be exposed to the overdose. I've had heroin overdoses where they have loaded needles ready to go that I've come very close to being in contact with. Always worry about your safety. Keep a high level of suspicion on what else may be going on. What are the routes of entry into the body? We've covered that. What are some things that you can do to prevent poisoning, especially in children? When you go into a house, you see small children, you see chemicals laying out. Cover that with the family. Cover that with the people on scene. You can use any moment as an educational moment for the community, for the public. So a farmer calls 911 because one of his farm hands has tried to clean up spilled pesticide powder with his hands. That's not a good idea. On arrival, you find that the patient insists he has brushed all the powder off, feels fine, and doesn't need to go to the hospital. As he talks, he continues to make brushing motions at his jeans, on which you can see the marks of a powdery residue. How do you manage the situation? First and foremost, you want to know what the actual chemical was. You don't want to be exposed to it. Personally, I would instruct him to grab a brush, finish brushing off, and contact poison control and look for signs and symptoms.